Welcome back to the Health Revival Show. We have Dr. Sarah Daccarett with us. She is a leading hormone specialist and founder of Inner Balance, which is a cutting edge hormone replacement therapy support for women working to catch us up to men. Because as we were talking offline, we are way behind the curve of men when I would dare say with confidence that we need it much more than men do in our later years of life to survive and thrive. So, thank you so much for joining us. We're really excited for this interview. Can you tell our listeners how you got into this, a little bit about you, what made you dive into the world of female hormone?
Yeah, definitely. Thanks for having me, by the way. Excited to be here too. I got into it because I needed it, really. Like the solution, everything was because I was trying to solve my own problem and realized there wasn't a solution for it. So I made one. And I was in my 30s when it happened to me. I delivered my son and it just like the wheels fell off the bus. Like I never really recovered. And there was nothing out there. And once I realized it was hormonal, I tried every single product. And none of the products like were made for like a 35-year-old to feel like she was 35. They're made for menopausal or postmenopausal women just to stop some hot flashes. It's literally micro doses of hormones. And so I had to create something. But we do it for men, and that was also the difference. Like I was a doctor and I was struggling. Can you imagine? I can't even imagine what women are going through. Like I had the tools, I had the knowledge. Actually, I didn't have the knowledge because I had never learned it in medical school. I had to learn it. So it was really to make myself like feel great and look great as I was aging. And then I practiced for a while in clinic. And then 2 years ago, like about a year now, started Inner Balance so that I could take what I was doing in clinic and do it online for everybody. So we're in 46 states now. But I saw the difference too in clinic. And it's also why I decided to go online. I realized that what I had was really a solution for younger women, that we are a decade behind men's health, as you mentioned at the start. We have no hesitation. We've come up with like tailored solutions for men. They do injections. We can raise their testosterone really well. We know how it like impacts them. They feel great. They feel like a 20-year-old. And for women, we still have this narrative for them that we tell them that they have to wait until they're 50, that they have to wait until their period stops before they can even consider HRT or estrogen. Estrogen has gotten this really bad PR campaign. I mean, there's so many problems with women's health that's been completely ignored. We have completely ignored women. And so this was why I started Inner Balance because I could see that is absolutely a need. And we're talking more about menopause, right? It's great. We have solutions for them, but nobody's talking about all of the other women below the age of
All
50.
right, if you're dealing with water
Perimenopausal,
retention, you're
endometriosis,
waking up puffy,
PCOS,
your ankles or your
postpartum,
wrists are really
especially
swollen,
like
or you
women
can't get your
struggling in
rings
their
off, and
20s
maybe
and
you're even
30s and
dragging
40s, like
throughout
all
the
day
day, no matter
long.
how much
And we
water you
continue to
drink,
tell them that
there's
this is
actually a
normal for
good
them.
chance
So
that you're not
we're
actually
here we are
hydrating
today,
properly.
really trying to close this
Exactly,
gap.
because water
It's
alone is
amazing.
not
I mean,
enough.
heck, you
You
can't even
need
get your doctor to check your
electrolytes, you
hormone
need
levels.
sodium,
I mean,
They
potassium,
won't. They
magnesium,
won't.
because those things actually
it's
pull water
such a
into your
fight.
cells.
So I'm
Otherwise, you're
almost 8 months
basically just
postpartum,
flushing it
and
out and wondering
I
why you're
was
still
bleeding
tired, you're
for
still
14
bloated, and you're
weeks,
still
and my
sluggish.
doctor's But solution was here's the birth thing, control. most She did electrolyte do, supplements the out there saline aren't helping ultrasound you and in all of any that as way well, but I'm because like, a lot of all them right, I ran contain my own things like hormones, natural and
Flavors,
obviously
food
postpartum,
dyes, and
what do we expect?
maltodextrin,
Depletion,
which can
but
irritate your gut.
really
And
total
these things can
depletion.
also
There
spike your
has to be
blood
another way.
sugar
So I
when you're
told her, I'll
trying to
give you
heal.
2 months
That's
on
why
doing
we
the
both
mini
started
pill.
using Buoy.
That's all
It's
I will
super
do.
simple,
But
just trace
if this
minerals
doesn't
and
work, you're
electrolytes
giving me
in liquid
progesterone. You're giving me
form. No
progesterone. Also, I
flavors,
was
no
like trying to play
colors,
the
no
game to save
sugar,
money
no
of having to
sweeteners,
buy it
and you
compounded,
squeeze it
right?
into
And which
whatever
she
you are
did.
drinking.
She eventually,
Water,
I said, I'm
coffee,
not going to take
tea,
both.
smoothies,
So
you name
when
it.
it stopped is
Yeah.
when
And
she
it's
gave me the
clinically backed
progesterone.
by science
Progesterone.
too.
So studies And I
It's
think that shown so
super
many
simple.
women
Buoy
out
helps you
there don't
hydrate
even
better,
know what to
64%
ask
better, in
for. And
fact.
so I
And
think
that's
that
data
this will be a
coming from
great
key
conversation
blood and
because,
urinary
like you
markers,
mentioned,
not just
it hits
marketing
earlier and
fluff. And
earlier.
honestly, you
And
can feel the
because you're not
difference. I've had
in,
many
let's say, your
clients tell
late
me their
40s,
digestion's
almost
improved, they have
50s, or
less
having
headaches, and
erratic
they're better
cycles,
energy throughout the
they're going
day.
to label
And
it
Buoy isn't
as
just for people that go to the
something
gym all
else,
the time
right?
and
Maybe it's
sweat a
anxiety,
bunch.
maybe
They
it's
actually
depression, maybe
offer
it's
a
ADHD. Like
35%
how
lifetime
many people are
discount
getting
for anyone that's
this
struggling with
diagnosis
chronic
of
illnesses.
ADHD
Things like POTS,
or
Hashimoto's,
something
Crohn's
else
disease,
that
chronic
really is
migraines,
either
and
an
every
estrogen or
autoimmune
testosterone
condition. They're
deficiency.
really committed
Maybe
to
they
making
just need
better
progesterone
hydration
to balance them
accessible to
out.
people who need it
Works
most.
for
I
many
actually
women,
throw it in my
right?
coffee
With
every
their
morning
moodiness
because
and their
it's such an
snappy and
easy
all that
upgrade.
stuff.
You don't
So
even taste
tell
it,
us a
but you're
little bit about,
definitely going to notice
where
if you
you
miss it.
were at
If
35.
you're
What were the
tired of
signs and
playing
symptoms that
hydration
made you
roulette
start
and
saying,
want something that
okay,
actually supports
I've
your
got to
body,
start looking
you've
at my
got to try
hormones
Buoy.
and
It's honestly one of
like
the
really
simplest
questioning
ways
that
to feel better
aspect of
faster.
health versus anxiety, depression, thyroid deficiency, gut health, other things. What made you kind of look into this?
Yeah, no, I mean, it's perfect. Like you're right. Women don't even know what to ask for and they don't even know like what should I be really worried about hormones? Because can I attribute it to just something else, which is what we're telling them. We're telling them it's something else. And knowing what I know now, I always had struggles with hormone problems. I think women like virtually like you take birth control at some point in your life and you don't even recover. And that you mentioned the birth control thing. It's like, why is that a solution? We don't have a fake hormone that it's not even a hormone. Birth control is not even hormones. It's literally this chemical that's derived from testosterone. It's synthetic. It's not even a chemical that exists in nature. We give it to women, it makes them infertile. And this has become like the catch-all solution for everything. Hey, you have acne, you have heavy periods, you have, and we're like, there's no informed consent. That what the birth control does is it suppresses your hormones to zero. They don't tell women the risks of doing that, and we just give it out like it's like the treatment for everything. Oh, you're crazy, you're anxiety, depression. Here's some birth control, and along with all the other pharmaceuticals. We literally, and we only study the birth control too. So there's like thousands of papers only on progestin, which is our fake hormone, and there's only like 5 papers on progesterone. It's our main hormone. So we don't do that to men. So you're right. It's like this birth control, like she was even refusing to give you your natural hormone and she gave you this chemical that we make. And why is making you infertile? Like it stops your period because it binds to these receptors, but it has like a different impact on these receptors than your normal hormone would. And so women need to kind of understand that they really should always be thinking about it. I think that and if you have more than one thing going on, that should be your clue that it's hormonal. But we tend to tell women that, oh, you're a leaky gut, your anxiety, like your leaky gut is, for example, is a perfect one example of this is the root problem. If you fix your leaky gut, then your anxiety, your irritability, depression, bad skin, your hair loss will get better. Or you have high cortisol, and this is the root problem. Or we continue to tell them that they need to like fix all of these other things. What women really do need to understand is that hormones regulate every single process of the body. They're literally the CEOs of the body. They bind to genes, they transcribe genes, they give us our like our feminine for example, features. They regulate metabolism, heartbeat, blood pressure, your skin, your hair, like your bone growth, like everything. And so when you start to feel something off, like anything, like even aging, like your skin starts to look saggy and like dry, your hair is like more thin and falling out, you're not able to gain muscle like you used to, you aren't sleeping quite as well, like they're attributing it to other things when these are hormonal at the root, like of everything. And they just need to be aware that this is, so if you have a lot of anxiety and maybe you've had it your whole life and this is your baseline, maybe you're quickly metabolizing estrogen too fast. And these are genetics that exist. They're single nucleotide polymorphisms. Some women metabolize faster than others. And so they just assume that ADHD and anxiety is like part of who they are, but actually they're not able to keep to these hormones very well and they don't understand that they need to be like always thinking about it. This is be the first thing. The women are like, oh, I'm tired because I have an 8 month old at home, but you're like, yeah, you're tired because you're like completely depleted. And yes, you should be able to handle your 8 month old and your husband or your partner and your life and your job. And oh, we want you, I still want you to do everything. Like I was postpartum and completely depleted, but I still wanted to work and like have a life and do all my, like, I wasn't going to just succumb to this like new life or new reality of being completely exhausted. This is not like what, so women, it's hard because women are like, well, what are the signs? Like, when do I start? What's the best time to start? You don't have to wait for everything to be falling apart. You don't have to wait for hot flashes. You don't have to wait for the irregular cycles. Those are the last things to happen. You really should be like preventing this decay of the body. Like if you start having sensitivity to food and your skin doesn't look as great as it used to, and you're really trying to change your diet and do everything and you're still not getting the results you want, you should be thinking about hormones. They're one of the most natural things that we could do in order to have great health.
Well, and you mentioned estrogen and leaky gut. I think a lot of people don't realize how important estrogen is to support the mucous membranes, right? So for motility, constipation, leaky gut, inflammation, like you need it all. It all matters, right? It's not just estrogen, of course, right? It's not just testosterone or just progesterone for people. It is a complex picture in which we believe, and I'm sure you do as well, in testing and addressing the person and figuring out what it is that they need as a bio individual. Because for someone out there, there could be an overtly high level of estrogen that needs to be balanced out, right? With progesterone or supported estrogen detox ways because of their genetics. While somebody else, like in Becca's case, in her history as an overtrainer, right, and chronic dieter when she was doing CrossFit competitions and everything, her hormones are completely depleted, right? And so it's like, what is it for you? Do you need to bring hormones back online? Do you need to bring certain ones back online? I love that you brought that up because I think, again, so many people will look and say, it's this at the root, it's this at the root. And there's not one root cause. That's the reality of all of, functional medicine. I think we need to recognize one root cause. People will say,
If the, yeah, sorry to interrupt you. If there is a root cause, it's hormone. like I think is like the driving home message, the take home message here. And like you mentioned, even when we tend to think of hormones being too high, like you even just mentioned, this is such a common misconception that women are like, oh, your estrogen's too high because they're told this. They're never too high. Like when you think about when they're not even too high during pregnancy. During pregnancy, estrogen gets up to 40,000 picograms per milliliter. And their estrogen will come back at 1,000 picograms per milliliter and they're told that it's too high. So like when a perimenopausal woman or even a woman in their 20s is told they have estrogen dominance, it's too high, this is still a problem with failing ovaries or like an ovarian problem because it's not a detox. I think this is like really important that we talk about this because women are being fearing estrogen. Oh, this is making me sick. Like I have too much estrogen. And it's your own dominant. The dominant hormone is actually progesterone. So what's happening to a woman when she has like too much estrogen, this quote unquote too much estrogen? And first of all, these reference intervals have not been well established. So even if it's 1,000 or 3,000, says who? Like who says that it's too high? First of all, there's no guide. There's like literally the guidelines and the reference intervals are not well established based on real science. So I would say they've always been set really low. And mind you, we did this for men. Like we told men that their testosterone only needed to be between 400 and 800 for decades. And now we push it all the way up to 1,000 and 1,500, and we recognize that these levels need to be higher for them to be in optimal health. So we're still in this spot for women where we're telling them that it needs to be like estrogen needs to be really, really low. Whereas like we know that optimal health and like women are very healthy during pregnancy when hormone levels get high. So if your ovary stops working, like fatiguing, just because as we do, like let's say we turn 30 and like everything kind of starts to age, our ovaries cannot make the primary hormone, which is progesterone. Progesterone is our main hormone. It is magnitudes higher than estrogen or testosterone, right? So like if you think about what happens in the body, there's like the brain like knows exactly what's going on in the blood, like how many hormones are there at all. And when the progesterone drops, the brain freaks out literally and starts releasing a substance called FSH. And this substance signals follicle stimulating hormone signals to the ovary to like make more. Like what's happening? Like we need to have a baby, whatever like the reason that the brain feels that way. It's signaling to the ovary to make more progesterone, and the ovary cannot. It's failing, but it can make like little spikes and spurts of estrogen, right? So it'll make like a peak of estrogen, which you happen to get a lab when you measure that because it's just one point in time. It's not like this measurement of what it was over 30 days. And so everybody's like, your progesterone's low and your testosterone's low, but your estrogen's way too high. You need to like take a bunch of supplements to detox and get rid of this estrogen. But in reality, what she needs estrogen too. She needs estrogen, progesterone, and testosterone. It should be a sign that she's not able to make anything. And so when you give her estrogen and progesterone and like the right ratio and the right amount, it calms the brain. The brain realizes there's enough hormone around. It stops releasing this signaling molecule FSH and it stops your own spikes, your own production. It suppresses that. And you actually end up with lower estrogen that's more consistent, like throughout the day. And you need it in the right ratio. Progesterone needs to be 10 to 30 times higher, and you put that in the right ratio, and then the body is like in balance and at ease, and then you're not having these like wild roller coaster spikes of estrogen. The problem is not fearing, you like we're fearing estrogen, and we just need to understand it. We need to understand, like women need to understand this process in the body. So this is like, I'm glad, like I don't know if you have any questions about that, but that's like virtually a huge problem that's going on right now. It's talking about how estrogen is we're being told that it's bad for us, really.
Yeah, we fully agree. We realize and talk many podcasts of ours discuss why estrogen is largely important, not only for perimenopause, postmenopause, but before that, right? But I would be curious because I just want to clarify and gain your stance. Hormones obviously influence things, right? And so we discussed heavily on the environment that hormones go into, right? With hormone replacement therapy, they are amazing. Hormone replacement therapy is something we advocate for, especially myself on my platform, like all the time. But if you have a metabolically unhealthy person, if you have an inflamed person, if you have a gut that is a total disaster, and now you put hormones in, well, you may not experience the benefit that hormones should bring to you because you have not addressed what is going on internally, hoping that hormones are just the solution when there are much bigger problems too that need to be addressed alongside hormones. And so I would just love to know, like, do you guys talk about that with your clients and, what they're doing? Or is it just, have you seen something different in terms of putting hormones in and everything gets fixed? Because I personally have it. And so I'm curious, like, am I
Well, I think I explained that a little bit more. Like when we look at this, we're thinking that things actually get worse for some
Yeah.
individuals. If they're coming in very inflamed, very metabolically unhealthy, we're seeing water retention, weight gain. Like it's not necessarily our clients because we don't advise them to do this, right? And we do that in phases and in steps. But people will come in, or like you get a lot of questions like, my doctor put me on hormones. And then you fixed maybe one problem and have seven other things that have now shown up. So just curious, in terms of that, are you evaluating some of those inflammatory markers and other symptoms that people are dealing with and then determining from there when is the right time, maybe after they've cleaned up their diet a little
Or the right
bit?
dose,
Yeah,
right? Because I think the dose is obvious. The devil's in the dose with hormones too.
sure.
And, putting in way too high of doses for certain people and not enough for other people. And so, yeah, there's it's a lot of,
No, it's a really great point, and I think that everybody needs to understand it. That when you start hormone replacement therapy, it's not just going to make you better. But it is actually going it's the thing that I do need to make it better. But the problem is that they women have waited so long that their gut health is so bad because the hormones have been low for a decade before they start hormone replacement therapy. So when you have something like the gallbladder that absolutely needs estrogen to function, and then you're depleted in estrogen for years and you've even been told to lower it. So like you've gone a decade without estrogen. And then when you start estrogen, it starts stimulating the gallbladder and you end up with like extreme bloating when you start HRT, for example. So women need to understand that it's not the HRT causing this or making it worse. Like you've literally been ignoring your gut health for like a decade because you've also like waited way too long to start HRT. That's the problem about like women need to be thinking about as a prevention and not as a treatment. So HRT is not going to treat your gallbladder disease. Like you have to actually treat your gallbladder disease because now you have it because you waited so long to start estrogen. So you have to continue. Like the if people get weight gain, if they get not weight gain but water retention is the biggest thing that women get, as well as bloating. So SIBO, for example, is like hugely, it's like super common. So women, their gallbladder starts to fail, and SIBO at its core is a gallbladder problem because the gallbladder releases bile that kills the bacteria that's in the small intestine that's not supposed to be there, and you get this like bacterial overgrowth, and then you get bloating. And then women can't go to the bathroom because their gallbladder's not working. So they start eating a bunch of fiber, right? So we're telling them to eat over 30 grams a day of fiber. And I'm not here to like take a side on diets at all. Like I know it's like almost like religion and politics these days. You can't like take a side on a diet. I'm not here to do that. I'm just like stating facts that if you eat a lot of fiber, this is going to make you more bloated. There's like fiber equals bloating. And so where they're already keeping their same diet that they've been trying to do to go to the bathroom for like a decade, and now you're giving them HRT and they haven't changed their diet because they still need the 30 grams. So it's like, so then now they're having extreme bloating because you're trying to stimulate a process that's broken. So with HRT, same thing with the thyroid. If you get so sorry to back up, but the key is to, let's lower this fiber intake, address the problem with the gallbladder, whether you need something to support this gallbladder in the meantime, while we're trying to fix like, and with gut health, it's everything, right? Because they probably have low stomach acid at the same time and you're trying to fix that. And so I would argue that the HRT is the root problem, but it's not going to be the solution if you wait forever. If you do it before, it will prevent it. But if you just use HRT to treat your gut problems, you're not going to be successful because you've like again waited too long. Water retention, thyroid. You're right. When you start HRT, you impact every single other process in the body. So you'll basically like you could raise sex hormone binding globulin. I mean, this is all largely dependent on your diet. For example, if you have like a high carb diet that could raise faster than somebody with like a lower carb diet. Like it does, it's diets really. Women need to understand how important this is. They're not educated about it either. But if you raise this, you'll bind up free thyroid. You'll get a lot of water retention. Even progesterone itself can cause water retention. Women are iron deficient, like extremely iron deficient, because if you bleed for 14 weeks, like you did after postpartum, and then you're trying to catch up with that, we need estrogen to absorb iron in the stomach. So women are deficient from estrogen for a decade, then they become iron deficient. Even if they have red meat in their diet, they're not going to be able to absorb that iron. And iron deficiency can make you extremely like hold on to water and they have water retention, and it's metabolic dysfunction. Insulin can make you hold on to water too when you start HRT. So women blame the HRT, like, oh, this is like because you put me on the wrong dose or you didn't get my ratio right, or like they want to blame the HRT for causing their water retention instead of just looking at like everything is an open system. You address one thing and it doesn't cause other problems. What it is it highlights that you have a lot of other healing to do. You do need to address your thyroid. You need to look at like your diet. I think diet's one of the biggest things that women do have control over that they can help. But it is it It's important that women stop looking at HRT as a treatment. Like it's not going to treat you. You need it. It's foundational. It creates the environment in the body that allows you to have optimal health. You need this. This is like core and foundational. But yeah, you're also going to have. Sorry guys, you're going to have to do all the other stuff too. Like you're going to have to do like every other piece. It's not like. But I say that the foundation is HRT. But then and if you wait too long, you are going to have to do a lot of other healing. If you have fibrocystic breast disease because you're iodine deficient, you're going to have to heal that when you start HRT because you're going to have your breasts are going to be super tender when you start. If you are iodine deficient, you have fibroids in your uterus. You're going to have to let this heal. Like it may not heal, probably won't with HRT. Like this is not going to treat fibroids. So, like women, again, this is why it's so important that women in their 20s and 30s pay attention because if you can prevent your leaky gut and your gallbladder disease and your thyroid from tanking and autoimmunity, this inflammation state that you talked about, all this is a dysfunctional immune system. We can talk about this inflammation and why it's so important for women. But if you go a long time without hormones in your all of your 30s, you are going to become more inflamed and you get in your 40s. And the treatment, like women have a very complicated immune system. Like if you think about pregnancy, like we talked about it a couple times now, women have to carry a foreign object and not fight it like it's a foreign object, but they have to have a strong enough immune system in order not to get sick while pregnant. Right. So like this is really remarkable and the body is extremely intelligent. I actually think the women's immune systems are unbelievable, remarkable that we can carry a baby for 9 months and not kill it. Basically our immune system not kill a baby. And we also don't die from infection, like when we were slightly immunocompromised during this time. And it's because the B cells and the T cells and all of the components of the immune system are regulated by estrogen and progesterone. It directly binds to these. So when you have low hormones, your immune system is going to be completely chaotic. You're going to be sensitive to foods. You're going to have eczema. You're going to get Hashimoto's. You're going to get all of these diseases of autoimmunity that women get. So, and you can kind of treat it. It takes a long time, but you're still going to probably have to change, gluten free, dairy free. You're going to have to do like a lot of this other stuff with the HRT in order to heal the autoimmunity, right? So now, because you've kind of waited too long.
Gosh, I mean,
There's so many things there. I want to unpack iodine a minute.
yeah,
I just had she's actually a friend from college that reached out, and it's very non-classical PCOS pattern, but she was treated as a classical PCOS. And by that, I mean she has the LH FSH ratio, but she's not androgen dominant. She's not insulin resistant. She's not overweight, all the things. What she is iodine deficient, and she's anemic. And I'm like, girlfriend, she's going in for an ultrasound next week to see because it's like blood, it's like a murder scene, like a crime scene. She just got her period back. This is her third one. She's like, they're getting worse and worse. And I said, yes, because you're iodine deficient and you are anemic. And so we have to address these things and we have to put progesterone in place. And then, sure, have the ultrasound. Let's check and see what growths are there. But those things don't grow unless, we're deficient in something. So I'd love for you to talk a little bit more about iodine because I truly believe there's so many women walking around with subclinical hypothyroidism because of iodine deficiency, not because of a thyroid issue, right? It's not a pituitary hypothyroid hyperthyroidism, it's iodine deficiency.
100% correct. And like we're telling women to avoid the thing that's going to heal them as well. Like we get women and we tell them to take iodine and they're like, they act like you've asked them to take some kind of poison because all over online it says that iodine's going to make you worse. And I'm like, why are we telling women to avoid iodine? It's really wild. The iodine, you're right. And there is this pathway between the bleeding and thyroid. And when you correct a thyroid, you'll see this bleeding correct too. It's wild. So, and I don't think we completely understand it, but I see it all day long. And iodine is at that probably that core. There are more receptors for women for iodine in the breast and the uterus than the thyroid too. So I agree with you that the subclinical hypothyroidism, but iodine and iron. So again, it's like tying into this like vicious cycle that they're bleeding because their thyroid's like getting low, and then they become more iron deficient, and they need the iron for the thyroid to function. And then this low thyroid results in low stomach acid, and then they're becoming even more iron deficient because they need that stomach acidity in order to absorb the iron. And then you've really got a problem, right? Now because you need the stomach acidity to get the gallbladder to work. And at its core, it could have been, was it really just an iodine deficiency that we're actually telling women to stay away from iodine? And you've just created. So I would agree that, like in these younger women who clearly are not ovarian failure women. I mean, maybe they are, maybe they aren't. Like I'm not, but could it be in a 25 or 28-year-old with this like picture that she simply is like her diet? She's not addressing like and eating the appropriate stuff because iodine is like virtually absent from our food. And there was there was like I have an OBGYN friend and she said that women are like the only animals on the planet that can like bleed for 14 weeks and not die. Like it's wild. Like, we really need to like women are just being dismissed about this bleeding too. And like shouldn't have like heavy periods are not normal. They should have really light and short periods. I don't think our ancestors had these heavy periods. And we need the iodine to maintain a proper gland structure in the uterus and the breast. So literally it metabolizes estrogen within these organs. Like they're endocrine organs. Like our breast and uterus are not just like they literally metabolize estrogen. Their methylation pathways too. It's not just the liver. We talk a lot about how the liver eliminates hormones, but the breast and the uterus do a bulk of that. And so we need iodine in order to make that process happen. And when you don't have the iodine, then those glands become completely like cystic, dense, fibrous. They get all this tissue there that's not supposed to be, and they become dysplastic. And dysplasia turns into breast cancer, right? So I mean, we've been blaming estrogen, but like, why aren't we looking at potentially a root cause of even cancer formation in these glands, in these really important, like in the uterus and the breast? And iodine is that absolutely. If I were to recommend any supplement, like for any woman starting at age 15 or like young kids, like it would be, we should always have because we're not eating iodine anymore. We need to. It's so important.
How do you typically, and I know that it could vary, but because of iodine's potential with thyroid growth and the concern that people have around that, how do you typically dose iodine? Because there are many belief systems around this. So I'm just curious here.
It's like such a good like topic to bring up because I know that it's like very much all over the place. And I'll recommend like 1,000 micrograms and people freak out, like are and you're just like, what is like so what I've women need to understand that they have like if you start iodine, what it's a large halide, with a negative charge, and the fluoride and bromide bind to the same receptor. And so bromide is found in like breads and like our processed, like I think they're grains. And then also fluoride is found in the water. And these are toxic. Fluoride's neurotoxic and they'll bind to the iodine receptor and prevent iodine from binding. And so when you first start iodine, if you're really deficient, which we've pretty much like established that everybody is, then and I guarantee like 99% of women that start RHRT gets breast tenderness, which tells you something. Like literally everybody is iodine deficient. And so when you start iodine, it kicks bromide and fluoride off the cup. You want to take enough iodine in order to do this. This is the trick. So, like, if you just take 100 micrograms of iodine, it's not going to do this. And this is the daily recommended allowance. And it's not going to treat your breast tenderness or your fibroids or anything really for women. And so, you want to kick fluoride and bromide off the receptor. And when you do that, you get like this reaction. It can cause extreme fatigue. It can make you feel like you have the flu. It causes like a nasty kind of feeling for a few days. You can get a rash. Like some women will get this rash on their chest and then they freak out because you told them to take iodine and they read something on the internet and you're just like, oh my God, this is probably just like you're detoxing from fluoride potentially. Who knows, right? Where they live. And then you need to take enough iodine. There's like a threshold that when this reaction starts to happen, the trick is you actually have to have them take more to really flush and get it off so that you completely occupy the receptors with iodine. And this is the only way they're going to do that. And then you have to maintain it. You have to keep iodine on the receptors so that the other ones don't bind. But I would say you would at least need 1,500 micrograms for this. But we see in some of our patients where you need more like 10,000 micrograms a day in order to really treat breast tenderness. So it's a really big range. And it really, like, women are really nervous. So we've started, like, our recommendation is lower just because we want to get them to take something, right? Like, just take it. Like, even if it's 1,000 micrograms a day, take something, even though they truly, sometimes some of them need 1,000 a day.
We've dosed upwards of there's some Iodoral. I don't know if you know that one, but we 6.5 I'm sorry, 6.5 milligrams or 12.5 milligrams a couple
Couple times
times
a
a
week.
week. But yeah, I think
Measuring.
it's a very hidden gem that shouldn't be a hidden gem of like it can solve a lot of problems, especially when it comes to female hormonal disruption and dense breast tissue and all of those things.
Well, can we
So
just back up and clarify? Because I don't think it came through super clear that in the presence of iodine deficiency, you allow the cyst and fibroids to grow because they don't grow if you have adequate iodine. So that's really why I brought that.
and chronic thyroid dysfunction too.
Well, yeah.
Because I think a lot of people are like, my thyroid just won't come on. And it's
Mhm.
like you brought up the elemental table And I love that you did. And what happens because we are onslaught with these other elements that basically take up the receptor sites for iodine, and you just don't have enough iodine. And even if you do, they might not be binding well enough. And so I love you brought that up. We've had this discussion, and
Fibroids. Like you talked about the hypothyroidism. Like it's like women will come and they'll be like, "Well, I have a nodule on my thyroid, like a goiter." Like some of them will have like straight up goiters. Like I'm like, this is like, on their thyroid, and then they're like, the doctor's just watching it. I'm like, they didn't tell you to start iodine? No, nobody told me to start iodine. Actually, they told me to stay away from it because like iodine's going to make it worse. And then they have
To
massive
watch it
thyroid.
until like
Yes, and then you have
yeah, we're just
exact no, 1000% like a thyroid cancer. Oh my gosh. And then and then they'll have fibroids. And then the fibroids I would say are like really hard to get rid of. Like once they kind of are in place and like again, this huge link, like women need to recognize that the thyroid is very much linked to their uterus, like everything in their body. Obviously the thyroid's like one of the other pillars, like the other hormones that's like really important. So but I don't think that women connect it to the uterus as much as they should, and it's iodine deficiency. And I completely agree with you that it should be it's so hidden. In fact, there shouldn't be so much fear. Like, why? Where did that come from? My endocrinologist told me not to do iodine.
yeah, it's so funny because like I'll have people who say, "Well, what happens?" Because we have them measure their neck each week. What happens if it starts to grow? I'm like, well, then we stop it, we back down. I'd love to hear from you how you like to test this because I will generally run an iodine serum test, but we also have to recognize that's in circulation, not exactly what's in the
perfuse.
tissue. So then I will also have them do the patch test where it's like on their skin and see if they react. And I think that's even a better one. But I would just, do you even test it or you're just going off their T4, their symptoms?
I did clinical pathology for many years, and the laboratory testing for vitamins is very poor. So, like, I would say, like, I never, you know what I mean? Like, you can use it as like sort of a guideline, but clinically, clinical. Like, you have to, like you were saying, like, are they getting better? I think these, like, the breast tenderness, the bleeding, and then the symptoms of like gastric reflux, and like this is like a thyroid. Like, we need thyroid hormone in order to produce stomach acid, and if they have digestion problems, this is like another clinical sign of the thyroid struggling. And I think so. The clinical signs of it, and you don't. And I love that you pulse it, that you're kind of doing that once or twice a week, and this allows like to kind of flush that receptor, but not go overboard. You can't go overboard on iodine. But that's the thing. It's like but we're not even getting close to that here. Like I get that you could overdose on iodine, but a lab test is again, if you're like you said, you're not measuring what's in the tissue or like even what's going on at a cellular level. You're only measuring what's like in the blood, sort of. And I'm not sure the reaction test is either that helpful either. Like I think women just need to see it as a. I just wish that like we weren't treating it so much. Like I wish they would start it when they were teenagers and it would just became part of their like health routine. You know, is where it needs to be, so that we're not trying to come up with these solutions together about how to get women to take it and what's the right dose and trying to treat the problem when it's already there.
Because
But
when they're younger, like progesterone's still coming online. And how many teens I have their moms reach out to me and are like, my daughter has these awful periods. She has acne. She has, they're worried about endometriosis and all of these different things in teens that these didn't used to be problems. Like, and I think this is a great segue to also talk about why we're experiencing such early ages of perimenopause, occurrence and people experiencing the symptoms of perimenopause earlier and earlier. And we already talked about one, which I think you would probably agree on is birth control, and how birth control is basically 90% of the population has been on some form for at least a year, which is, I think, just one large social experiment of females. But would love to hear why else you see this become now. Maybe there's more awareness too. I don't know. I don't think that this was as much of a problem 30, 50 years ago. And what
Well, it
you've
wasn't because you look at the, sorry to interrupt you, but it wasn't. If you look at the autoimmune rates,
yes,
they're skyrocketing in children ages 13 through 17. That is the group. So it's that generation and the generation following that. I mean, you've already mentioned it. We don't get iodine in our soil. We also think about things like magnesium, right? Our soil is depleted of it. We're not giving our kids good quality ingredients anymore. It's whatever is on the shelf that's full of colors and Skittles. And because
stupid marketing.
yeah, like I literally had an argument with my son at the park this weekend because I said, these are your three options that are dye free. Like, this is what you get. You're not getting all of those. And I get it. It's pretty, but yes,
Carson, my
I would
son, has
love.
a summer berry refresher that is blue and pink and has all of this stuff at Starbucks. And I talked to the lady and I was like, is there any way to make this less sugar? And she was like, oh, you can get it with water. I was like, I'll take it today because I'm not about to, but like it is just everywhere.
They're
Like it is
inundated.
impossible to avoid.
You're absolutely right. It's like such a grind. Just makes me. I have a 9-year-old, so like I know exactly what you're talking about. Like you should go. She's going to the grocery store for a parent shouldn't be about like warfare. Like when you go down, trying to check out, and it's like all one. You have to constantly be like, no, 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 no. Like it's just anyway. I just get everything delivered now. But like the. I agree. I think that the perimenopause thing has probably always happened. Like, kind of ovaries probably always started failing in the 30s. Now we're starting to recognize it more, like we're women are required to do more now, and so than our grandmothers did, that maybe were, for example. I think that's probably maybe always been a thing, and we're just recognizing it more. But truly, these teenagers and 20-year-olds, this I feel like is new. And the environmental chemicals like the phthalates, the fragrances, like women teenagers beauty products, like if you walk into like a Sephora or like a Bed Bath and Beyond, or like you're just like inundated with this like fragrance, and this is really really bad, like for women or everybody, people. But like the phthalates, these are the fragrances, and we know that these phthalates cause breast cancer, for example. But like the pesticides, plastics, phthalates, these all bind to estrogen receptors. So like they don't bind to the testosterone receptor. They're not disproportionate. They're disproportionately affecting women. They're not really impacting the men as much, or like the teenage boys. You could argue that there's probably birth control in the water. Again, this is not estrogen. This is a chemical that's maybe not breaking down in the water, right? So we're peeing out this chemical, and then this could be impacting these young people as well. But I would say the chemicals are just everywhere. You cannot like almost like you and parents are not being informed about the like when girls start putting these lotions on their body, for example. And I think this is maybe when it starts. They're using a lot of chemicals, but the estrogen dominance thing that you mentioned, when you have a chemical like a pesticide or a plastic or a phthalate bind to the estrogen receptor, your own natural estrogen is not able to bind. This will result in like a high level in the serum as well, because it's not binding to the receptor and it's not doing what it's supposed to do. And we've been, kind of, we call these chemicals estrogens, which drives me crazy because we're basically still telling women that the estrogen is a bad thing. And so, but they're not estrogens. They just bind to the receptor. And when they do that, they have a different signal into the cell. And it's usually like a bad one. This is where we know that, like, when phthalates can cause breast cancer because they're binding to these estrogen receptors, but you're also preventing your own protective hormone from binding. So when you have a 15-year-old who's being exposed, she has all these chemicals on her estrogen receptor, her own chemicals are not binding, and they're essentially making her infertile. Like if your estrogen cannot bind, you could potentially, so yeah, now you have an infertile, and that's where the endometriosis, the bleeding, the acne, because her own estrogen, she'd have beautiful skin if she had estrogen on board. Her acne is probably, I mean, it could be thyroid, it could be other things that we're talking about. But I think in reality, it's like her hormones are not being able to act because they're being occupied by chemicals.
Can I ask you a question? Because I've been having this conversation back and forth with someone on Instagram, and it really breaks. If you feel tired all the time and you're drinking water, you're probably missing electrolytes, because you need electrolytes to get intracellularly hydrated. We love Buoy because this is an easy way to get in sodium, potassium, magnesium, and trace minerals into your day without any of the junk fillers that most powders use. My heart. And mom is doing what she can to figure out, maybe working with our team because we have a pediatric team. But the doctors at 9 years old, her acne was so bad, they put her on Accutane, and because of the federal mandate, is on birth control at the same time. And I'm beside myself, to be honest with you, in terms of, yeah, I'll just leave it at that. What are your thoughts?
Just no, well, I think the biggest problem, well, there's a lot of problems here, but like, I mean, there's no informed consent. Like, I really feel like that nobody, like, nobody, no doctor tells the risks of birth control. I'm sure they went through the risks of Accutane, and that's why, like, all that is pretty clearly. That's like you have to like sign up to be a practitioner and like do all those risks. But birth control is literally like it's like nothing, and they don't tell anybody those risks, and you are creating like a bigger problem by doing that. And it's very sad. It's like devastating. 9-year-old, like, is she going to go through puberty correctly because you've like basically put her on something that suppressed her hormones before puberty? Um, it's
You have the liver impact, right? So the conversation started with her and I, just around why the triglycerides are elevated and liver enzymes elevated. So I was explaining that to her, that our doctors can't explain to her, which I don't understand that piece either. But yes, you're suppressing this natural production of hormones that should be coming on. She's 12 now. She's been on for 3 years, right? And so you maybe address the acne at the surface. But I also look at this in so many other facets, right? Beyond just all the chemicals, what's been going on with her gut health? What was her childhood like in terms of shots, vaccines, medications, antibiotics, all of those things? What are genetics? Because there's a lot of genetics we can look at for acne and whatnot. But it just, It's really, really sad because what are you going to set her up for long term with her overall health? Because as you mentioned before, we have a miraculous immune system. But that immune system can also get real confused by some of these chemicals that
By
we're
birth
putting into our
control.
body.
Well, it's like you're basically like it's wild because it's like, are we seeing that? Like we're seeing this huge rise, like potentially in endometriosis and PCOS of women in their 20s. Like I would say that's new. Like so again, perimenopause, menopause is normal. We've seen that, but like this new stuff that's going on. Is it because we put these 15-year-olds? Is that the population that we put forever on birth control and now they have endometriosis? Because endometriosis is essentially an autoimmune disorder. That's what it is, like at its core. And so you like you said, you're not even thinking about that impact to the immune system or something. And then you're giving her autoimmunity later. You're trashing her metabolic system. Like you're not. We need estrogen to make GLP-1. We need progesterone to help like with that whole pathway to maintain like your weight and like not get diabetes. And so we are creating a lot of problems in 20, like now later 20-year-olds who are put on birth control at a young age. It's wild to me. We'll suppress 15-year-olds hormones, but we will not give a 40-year-old estrogen. Like it's just so completely backwards, like how we're approaching hormones and how we think about them. And like like we should definitely approach this teenage or a lot differently.
Like, do we think that maybe somehow the body is seeing the ovaries and the uterus as a problem or a threat because they're not functioning how they're supposed to in a stage of life when they should because someone's on birth control, right? Like, is that how this autoimmunity is potentially attacking the ovaries and the uterus more than it ever has? Because I mean, obviously there's it's shutting it off. Like, there's dysfunction. And with birth control, we elevate T cell and B cell activity, and we end up in this state of like a hyperactive immune system. And I'm wondering if maybe there's just some type of connection
Well, and
of,
the
Right.
depletion of all your nutrients,
yeah,
right? It's the number one leading prescription besides proton pump inhibitors out there.
Thank you for saying it. But like, I agree with you. Like, I love that you're kind of like, what's the chicken and the egg here? But like, I have an opinion about what the chicken and egg is. Like, I think that, you're saying that the autoimmunity is like causing the depletion of the hormones potentially, but I actually think that the hormones deplete for like the various reasons I mentioned. And the immune system is not being appropriately orchestrated or regulated by the hormones. And the autoimmunity, when it happens, like we tend to silo it. We're kind of like autoimmunity is one of my like specialties because I had it. And so again, you have to really like to solve the problem and try to treat autoimmunity, it is like its own thing, especially in women. But when you have, it's not just like your thyroid that's being attacked. Oh, you have Hashimoto's. It's everywhere. It's everywhere. It's like literally attacking everything in your body. It happens to attack glands. One, because we can measure that. I will like point out that we can measure those. So we know that it's attacking your thyroid gland or your pituitary gland or something because we have a lab test for it. But we literally don't know like if it's attacking what else it's attacking in your body. It's probably attacking everything. It happens to like tend to go after like a gland because of like the nature of it. And so, but it doesn't mean that it's not like in your skin and attacking like essentially everything. And when you have there's molecule like progesterone, for example, it will break down into metabolites in the uterus. So one of them is called DHP, and this DHP is like extremely potent to regulating the immune system. And so the uterus, women, like we pretend like the uterus is like just a baby maker. That's it. That's all it does. But like it literally does like a lot of things, and we don't even study it. We take it out like it's nothing. Like, oh, you'll be fine. Like that's like what we do to that's what I took my dog. Like I just want what I mean? Like why are we doing it? Like women, like we're not going to take out like an organ. Like this is your girly part that we probably need to like, think that maybe it's doing something else in the body besides housing a baby. But like if it's making these metabolites DHP, like if your uterus metabolizes progesterone, and when it does that, these anti-inflammatory metabolites that it makes are stronger than the progesterone itself, and that's why potentially like in endometriosis the immune system is targeting this endometrial tissue, right? Too. So you have cytokines being produced, definitely like an immune involvement, like as you mentioned, to these specific places in the female body potentially, because we don't fully understand what they are doing with the hormones, and because we're not studying it. Like we literally like, okay, well the uterus doesn't do anything. So this is a huge problem. We need to be. I know the basic biology process, but we should know a lot about this, like DHP. We should be able to measure it in the lab. We should know exactly like how we can raise this so that we can protect the uterus and the immune system.
so hard to measure. And like that's what I think why you mentioned autoimmunity attacks glands because we can measure glands. Like we can measure the function of those glands and antibodies in those glands. But like measuring the immune system as a whole in the body is near impossible. And so it, like you said, when we have the same belief system, when people are like, well, I have this autoimmune condition, and I'm like, that's not the problem though. The immune system's the problem. Like that's we
Or they don't recognize, like you're saying, endometriosis, PCOS. We think about rheumatoid arthritis. We think about psoriasis, eczema, rosacea, all of those things, even though maybe they're not all classified as autoimmune, really come back to the immune system.
It's inflammation. No, like, so like I think when we're like, what is inflammation? Like I think we could even just be like, if you ask somebody that, they're like, they actually don't know. Like even doctors, you're like, what is it though? Like tell me, like what is it? Like really, like just tell me. They have no idea. They're clueless. Like when you like we throw around that word like it's like just something that And so really, what is it? It's like this system, the immune system has to be in these and we can measure it. We measure it for cancer patients, like when we know when they have like B cell lymphomas and T cell lymphomas, we can measure like with really fancy lab instrument. We can measure the ratios of T cells and B cells and like look at them and see if they're abnormal. But for like a wellness, this is not going to happen for wellness, right? We're not going to look at it. And we don't even know if that's normal. Like, how do we know what the correct ratio is for B cells and T cells? But so when these are out of whack and like our natural killer cells are low and our T helper cell 2 cells or whatever are too high, you're going to get this like essentially a chaotic immune system where when you're sick in the winter and you're trying to fight a virus, your immune system doesn't fight it and you're really sick, like sicker than everybody around you. But yet you have eczema like all over your skin because your immune system is fighting your skin. So it's like when the immune system is not targeted, like it's on all the time. It's literally like one of the most important things in our body to like keep us alive. And when it doesn't know what it's doing, it'll start fighting things. It just wants to fight something. And if it's not orchestrated, it needs to be fighting the viruses and the pathogens and keeping HPV at bay or that we're constantly exposed to these pathogens. And when it doesn't do that, it's going to start fighting your glands, your skin. And that's what inflammation is. Inflammation is like that. And it could be from aging, like inflammaging, but it's really this like the hormones that we're talking about. But that's all it is. So really, all of the autoimmunity, as you mentioned, is it's like core, it's inflammation, and we even suspect that like, it's type 2 diabetes, heart disease, like cancer, literally everything is a disease of the immune system. If you do not have a healthy immune system, heck, it's everything.
I love that you just covered that. I mean, like whenever we go through genetic tests sometimes, and there's a whole page of inflammatory genes, and I'm like, inflammatory is immunity. Like these are equivalent. This is what it is,
And
and
what are
it's
the things that support this? Calming it down.
yeah,
Progesterone, testosterone, LDN,
LDN,
TB, right? Like, it's hormones and cortisol, too. And so that's just,
yeah. So okay, let's kind of bring ourselves up because I feel like this
we
could
could
be.
just go off forever on
I
this.
feel like people listening might not even be following anymore because we've gotten so in the weeds of like what we want to talk.
It's
Let's
probably, what the hell is a T cell and B cell?
we've gone over that. So I would love to bring it back in terms of okay, actionable things of
Mhm.
if females are struggling. And you talked about, which I love, preventative, like how hormones are preventative. And talk a little bit about your company and what you have created and, how you work with people and why you got into this and, everyone needs to dive into this at some point because I think every female in their mid 30s and even before then, like you said, hormones are orchestrators. And we know firsthand when someone comes in and their hormones are completely bottomed out, like we cannot do anything to you. Like you need to bring hormones back online or else you're just going to feel worse and worse. And it is, the depleted state. Like you're not going to adapt to exercise. You're not going to adapt to fasting. You're not going to adapt to anything because your hormones are so low. And so I would love for you to talk a little bit about what type of solution you have built and, how you work with people.
And I'm also just say really fast, I'm laughing because we have so many people who come in and is like, no, I don't have mood swings. I don't have anxiety. I don't have this and that. And like as practitioners, we're on the other side of the messages that we get that are very bipolar sometimes. And when we give them hormones,
Like,
they're totally different.
like you're sedated.
They're so even keel and like life is good. And it's just completely different. So I just throw that
I
in.
love it. Like, and women love it too. Like, I don't think they realize how on edge they are when that first visit, and then afterwards, you're just like, it's a totally different conversation. They have different priorities, they have different like outlook, and it's like it's amazing to see them change. Like when they start HRT, like how, and they love it too. Like they come in sometimes like I'm gonna get a divorce. I hate my husband, or over the next visit, it's like everything's fine. Like, and they're really like focused on what they can have control over, and then it's like people do better when they feel better and they'll start doing the dieting, exercising if you kind of at least, I know that it creates problems, like you said, like if the water retention, but they tend to, if they start to feel better, then they're like into it. Yes, I want to heal this. I want to heal that. But if you were younger, a lot of the formulations aren't that effective. Like Prometrium, 200 milligram oral is very common, and it's like completely degraded by the liver. Like 80% of it's gone. And so we don't give men oral therapies, for example, like oral testosterone, same thing, unless it's going to lymphatic system, it's like completely degraded. So the approach that we have with younger women is to give them something that is, women need to understand that it's not just the hormones that matter, but the way you're trying to take them. The formulation matters. If they think a patch and a pill and like a low dose vaginal cream and then testosterone cream, and then you're doing one on one, it's like, sounds like it's really exhausting. First of all, and you're talking about 4 or 5 different products, and then you're trying to like piece it all together and like patch, like why? We have self-driving cars. We have like a lot of technology that you guys are talking about genetic tests on this like show, and we're piecing together like our HRT like it's 1990. So I think that women need to understand that like if they really want effective, and if you give a woman with PMDD or endometriosis or even autoimmunity oral progesterone, it's not going to help her immune system. It's not enough. It's not in the right formulation, and you're making a lot of toxic metabolites this way. And so you're actually potentially making her autoimmunity worse. Like I agree. Like you're doing all the other things though. There's a lot of practitioners are not. So you're addressing like a lot of the other parts of the body, but I would argue that that's not as common. And so they're just putting people on HRT, and then like, and autoimmunity is like treated differently. But if you really wanted to treat a younger woman, you would need a different formulation. So if you really, you have to break down all the other forms and tell women why they're so terrible. Like if orals are metabolized by the liver and patches do not go into the skin, like progesterone doesn't absorb through the skin. It's not been shown to protect the uterus. Only 30% of it absorbs, maybe. It's such a big molecule. It doesn't go through. And then, so what are we left with? Like injection? So the injections that are on the market, I don't want to inject every day, but like, do you guys? I don't know, but you have to inject a lot in order to get the dosing right to really help with some of the stuff that we're talking about. And so my formulation is vaginal, because vaginal, we've been telling women for decades that it's not systemic, but that's because they're low dose vaginal creams that we've been giving them, and they are meant only for vaginal dryness. It's well known that the vagina is like extremely absorbed. She can like absorb right through it. The wall goes right into the bloodstream, kind of like an injection without having to do an injection. So this way, it's more appropriate for a younger woman. So the dosing, the formulation, the application, and like the timing and getting everything into the right ratio matters. So young women do have like an option now, whereas like I don't think they had one in the past. Really, like this, aren't you're taking, even for you, it's like you mentioned the progesterone. It helps. It's better than nothing. Like the Prometrium, like if that's all you're giving her, and then you're having to probably do everything else, right? So, and that's okay. You should, like, we need to. We already established you have to do that, but what if you had something better? Like, what if you were able to get these levels up to what they were in your 20s potentially? And then you could have optimal health because we know how protected they are. So we're online too. And this allows you to kind of break down some of this gatekeeping, because a lot of providers won't give women HRT. Like they're afraid to do it. They don't know how to do it. It's not their training. It's okay. Like not everybody, I don't know how to do orthopedic surgery. I don't know how to do OBGYN. Like I can't deliver a baby. So they don't have to necessarily pretend to do HRT either. It's okay. Like we don't need every provider to be able to do HRT. Go to a specialist, and this way they can come and there's specialists that can help them through the side effects. Because as you mentioned, there's a lot of side effects that can happen. And it's okay. We can work through it. We can recommend some supplements. We can tell you how to address it or what to look up or give you more information about your gut health. And so even though we're online, we have more of a limited capacity to do this, but we still help. We still recognize that you are going to get bloating when you start. And this is how this is probably successful if you do this to treat it. And so trying to allow that kind of get accessibility. So like women that are in like smaller towns too may not have like a provider that they can go to. They only have their generalist who doesn't know anything. And so it's a way that they can access it online easier too. So you can sign up, and then we follow you tightly. So we don't sell you a cream. And then if you want to, we can adjust the dosing a little bit, mostly raise it because we put you on a starting dose. And you don't have to get labs to predict the starting dose. And I don't have time to talk about labs, but it's like this is kind of a good process, especially for women who don't have a provider to help them in like a clinic.
Yeah. So you're starting low and then you're following symptoms, right? We always say symptoms trump labs, but then you are also looking at labs. How frequently do you like to look at labs if you use those?
We don't require labs, but like what we a lot of our patients like to get them still. It's fine. We recommend like that you wait 24 to 48 hours, right? Because if you put like an injection in the body and then you get a lab, you'll get a peak. So we have a process for them to get labs if they want. We recommend like at 3 months and then like maybe before you raise the dose, or you can raise the dose just based on symptoms and then go from there and then kind of make sure that you're in. Yeah, a lot of women just want to verify that their estrogen is a certain level to like for protection. We know it's hard protects against Alzheimer's and osteoporosis. So it has to be these certain levels. And so they'll just verify that or verify that their FSH comes down. But we really can do it based off of these symptoms. Like if you're feeling better, um, this is like really all that matters because you could be feeling terrible and your labs could be completely negative. So it's just like don't I mean, um, it's okay to like follow them and have guidelines and it's kind of fun, but like I think we're going a little bit overboard. Like women will buy these devices that are like taking their urine every day or like their blood every day or whatever. I don't know if this is valuable for women because everything is such in flux all the time for them. And like you said, that's in the tissues and the blood and like it's being shuffled between like everywhere. And this is like going to wear you out if you spend a lot of time looking at the labs. But
So, in terms of following the symptoms, I would be also curious. There are some providers out there who just, there's no upper limit, right? We're just going to take you as high as you feel you were when you were 16 or whatever. And I don't know that I necessarily personally agree with that either. I think it's like, let's get you to a place that you feel really good and you feel optimal. But like, why continue to elevate a dose of something if you feel really good? Because I see this happening and I see it happening a lot, even with GLP-1s. We've had this whole big debate on this, right?
so I
Before-
agree with you. GLP-1s, I know where you're going. Like GLP-1s, like definitely, like you should do the minimum amount of that for sure. And if you get like a result, then great. With HRT, so the I mean, guidelines are actually like take the patient up until tolerability and then back off. That's actually literally what it says. Is that as soon as she can't tolerate that, then that you've found like your kind of upper limit there. I would argue that we can't really use labs to do this because there's no established optimal reference ranges. So I just want to point that out. But the only thing that's been established is testosterone. And so, not surprising, anybody on the call, I'm sure. But like estrogen and progesterone, like when you say like are the providers taking them up to like what they were in their 60s, there's no evidence that that provider even knows what that level should be. So it's really like, I've heard from patients that, oh, my provider told me that progesterone should be 10, 10, like, which is actually 10,000 picograms per milliliter. And there's very limited evidence, very limited. And we know that women in their 20s, when they ovulate, it maybe does get 10, 6 to 10. But like, who says that this is optimal? Has not been established. We haven't based these lab tests on FSH or anything. Anything. There's nothing out there. So I would say that it really is like I agree because if you're feeling well and you raise the dose on that person, like you got to watch them because more is not always better. You could actually then start getting that water retention. You could be putting too much stress on the thyroid pathway, putting too much on, like trying to do too much with the hormones. So you're right. It should be like this happy sweet spot where they're feeling great and then you stop. Like you shouldn't try to, there's no evidence to show that you keep pushing that up, you get more benefit. In fact, you could start to see side effects if you push it up.
Yeah. So, can you let people know the name of your company and where they can find you on social media and all of the good things? Because I think this conversation has
Yeah.
been amazing.
And also, do you serve women through menopause as well? I know we're talking a
Yeah,
lot about younger
younger.
generation, but do you follow people and serve women in the perimenopause, postmenopause years?
Definitely. So we're online at www.innerbalance.com. And we're in like the 46 states, as I think I mentioned. And then we do treat women 21 to 64. As long as you get started by 64, then you can stay on it as long as you want. But we do have a cutoff just because it's a little bit harder, like in an online setting. That's all. But anybody over the age of 64 should still be a candidate against that. They just need to see an in-person doctor for that. It's a little bit different. And we certainly treat the menopausal like 50 and above, like, or, 55 and above differently. Like there's certainly like they're a 55-year-old has different HRT needs than a 35-year-old and a 25-year-old, very different. And so we do have like a different product and like a different kind of ratio in pathway and treatment. And we expect different things from them. And they also have different expectations. So I agree that we should be treating them as well. Like there's absolutely no question about that. So 64 though. Gotta still get started. You gotta get started, ladies.
I always tell people that. And then people are like, well, I stopped it because I went through menopause and my symptoms were gone. I was like, no, symptoms are a small piece of what HRT does for the body. Like,
not a treatment. It's not a treatment. It's like yeah, it's not a treatment.
Thank you so much. This has been amazing, and I think our listeners are going to love this. And yeah, we go check it out. Go check out Inner Balance. Go check out Dr. Sarah, and we will see you guys on the next episode.